Okay.
Hello and welcome to our open house. My name is Ryan Kennedy. I am happy to see so many people joining us today. We're going to talk a little bit about our certificate in global tobacco control, hopefully answer some questions about the certificate program, and detail some of the aspects of the certificate. I am faculty in the Department of Health, Behavior, and Society at the Bloomberg School of Public Health at Johns Hopkins, and I am the director of the certificate program. I want to welcome my colleagues today, Carla and Lauren. Lauren, do you want to introduce yourself?
Sure. Hello, everyone. My name is Lauren Saplicki. I am a faculty member in the Department of Health, Behavior, and Society at the School of Public Health at Johns Hopkins. I also am a research scientist at the Institute for Global Tobacco Control, and I am one of the course instructors for this program, which we'll talk about. I teach in the last term.
Great. And Carla?
Hi, yes, I'm Carla Clemens. I'm a staff member at the Health Behavior Society Department. I am the program coordinator for the Certificate in Global Tobacco Control program. So I'll be, if you're applying or in the process of applying, I'll be your point of contact for any questions that you have during the process and then during the academic year as well.
And very involved during the academic year too. Carla is there to help everyone get through the program. So this is what we're going to touch on today. We're just going to provide greater details in about the specific program, the curriculum. We're going to hopefully, we've all been living online for many, many months now. And fortunately for us, this certificate was offered online years before the pandemic started. We'll talk a little bit about what online learning is like through our program here at Hopkins. Carla will share some of the specifics around the application process and scholarships, and then we'll have an opportunity for questions and answers. Hopefully answers. We'll certainly have time for questions. So a bird's eye view of the program, this is roughly a 1-year certificate program. Folks start end of August typically, and we have, I think it's a fairly interesting academic schedule here at the School of Public Health. We have what are 8-week terms. So in this program, the 1-year certificate, you study that over 4 terms. First term is sort of end of August till around the end of October. Then we go right into term 2, which typically concludes towards the end of December. Then we have at Hopkins what we call winter intersession. It's most of January, and so there are not traditional courses held during that time. We pick up again in term 3 towards the end of January for another 8 weeks, and then we usually get a week off between terms 3 and 4, and then term 4 will go through and end sometime towards the middle or end of May. This is technically a part-time program, and it's 100% online, which means there's no need to travel to Baltimore to take part in any of the studies. The courses you'll take have variable amounts of credits that you'll earn. Some courses are 2 credits, most are 3, and some are 4. And we'll talk a little bit about that more. But during each of those 4 academic terms, students enrolled in this certificate will study 2 courses. So there is always 2 different subject areas that you're studying throughout the program. The approach to the pedagogy, or what and how we've structured the certificate in terms of learning, is that we try to do as much applied learning as possible. In some classes, you might have group assignments. There's opportunities to learn from peers. As much as we can, we've tried to build up specific skills, whether those are in methods or research or problem solving or communication. The projects you'll work on draw from real life examples. They're very contemporary in its subject matter. And the real goal of the certificate, and this is perhaps the most important thing that we'll try and characterize today. The most important goal of for us in administering the certificate is to really train people so that they can be more effective in tobacco control. And so we're really looking for people to enroll in our certificate program who are currently working in tobacco control areas, whether that be in civil society or in government settings or other public health settings where these skills would be applicable to help advance tobacco control policies globally. The courses, you might think, well, do I have to come into this? This is a graduate level certificate. Do I need a specific background to be enrolled in this? And you don't. Public health, tobacco control, obviously is a range of, well, many of us work in this area with diverse backgrounds. We do require for our courses that we offer online, you to take an introduction to online learning, which is a brief course that really introduces you to what and how to use our online platform. It's called Course Plus. If you're familiar with any sort of university online systems, they all seem fairly similar in my experience. Course Plus is where all our lectures are housed. It's where and how you can send emails to your classmates. We have discussion forums that are posted in Course Plus. So in a specific class, there might be a topic that your instructor poses and you'll be asked to consider it and post ideas and then perhaps share and engage in a discourse with your classmates. It's also where all the library and resources will be. I think for most of these courses, you're not obligated to purchase additional reading. Things will be provided in our online library. As a student at Hopkins, you'll have access to the library system here as well. The students at Hopkins are also obligated to take an online brief course in academic and research ethics, just to make sure that students are all on the same page with respect to what is expected and what traditional processes are here for things like what and how to reference work in your assignments, what and how to avoid things that might be considered plagiarism. Excuse me. The courses for credit then, we're going to sort of briefly describe those that go through. Like I said, the certificate program is over 4 terms. There's 2 courses per term. In the first term, and students, I think, Carla, you'd probably agree that students get very excited about the first 2 courses that get offered in term 1. They're taught by some real veterans of tobacco control here at Hopkins, Ben Lazare and Fran Stillman. Ben teaches a class that is focused on communication skills, and it is a 4-credit class, so it's one of the heaviest classes that students are enrolled in, but it really focuses on step-by-step implementation and evaluation of communication programs designed to support behavior change, which is very relevant in the context of tobacco control. The second course in term 1 is offered by Fran Stillman, and it is a really interesting perspective on tobacco control. It's almost like a history class in terms of sharing what and how the tobacco epidemic has evolved, but also what and how different policy approaches have been used globally with success. There's a real focus on understanding tobacco industry activity and what and how the industry has repeatedly, strategically been successful at undermining policy efforts so that all of us working in tobacco control can be better versed in some of those tactics. And we go right into second term. And second term, we have 2 courses. One is taught by another real expert in tobacco control, Steve Tamplin, who teaches a course in leadership in tobacco control. And this is a course that draws a fair bit on the literature from the field of business. There's a lot of activities that students engage different exercises and assignments, looking at what and how to be a more effective leader in tobacco control, what sort of knowledge and skill sets are required to be an effective leader. You'll be introduced to frameworks, things like systems thinking, and what and how to manage teams and effectively deliver programs. The second course in term 2, I teach, and it's called Tobacco Regulatory Science. And it's a course where we really look at tobacco control from the perspective of the tobacco products. So we look at product design features, we look at the engineering and design considerations for cigarettes, for smokeless tobacco, for other combustible products like BDs, Kretex. And we look a lot at some of the emerging tobacco and nicotine products that are on the market or are emerging in different markets around the world, such as e-cigarettes and heated tobacco products and nicotine pouches. And it's always a very interesting courses because the students in our certificate program tend to come from countries all over the world, all of whom have different tobacco use profiles and all of whom have had different experiences in the tobacco epidemic. So there's very different perspectives on what and how to navigate some of these emerging products. Lauren, can you describe the courses that we deliver in 3rd and 4th terms?
Sure, I'd be happy to. So after your intersession winter break, we'll pick back up in mid-January. And so the 2 courses in term 3 are quantitative methods for tobacco control and a really applied professional development class called writing for results. So the quantitative methods class, so this is a 4-credit course, so it's a little bit heavier on the credit load. This is taught by Kevin Welding, who's the Associate Director of the Institute for Global Tobacco Control and actually an economist by training. So in Dr. Welding's class, you'll learn different approaches like how to correctly interpret statistics, best practices for survey design, all of which is intended to help assess sort of the burden of tobacco-related diseases and evaluate any prevention or cessation interventions that you are using in your work. And so assessments for this class are quizzes, short assignments, and there's also, you'll have the opportunity to work on a qualitative or quantitative research study proposal on a topic that's relevant to you. Again, kind of getting at that applied experience that you'll get through these teachings. The second course for term 3, like I mentioned before, is a professional development class. So this is writing for results, and it's taught by Brian Simpson, who's the editor-in-chief for our really wonderful Bloomberg Public Health magazine. And so what Brian will do is kind of walk you through a systematic approach for writing and communicating your ideas. And this could be to leaders and to the public or even to your team. And sort of you'll go through best practices for common forms of writing, like reports or proposals or even op-eds in your local newspapers. Again, assessments for this course include written assignments, of course, and quizzes, as well as participation on the discussion board and some live talks with the instructor. And so all of the discussion board and live talks take place, as Brian was mentioning, through Course Plus. So shifting gears, you'll have that 1-week break and then start again mid-March. And the first class in 4th term is the complement to quantitative methods. It's called Qualitative Methods for Tobacco Control, and that's actually taught by me. And so I have sort of a specialization in qualitative and mixed methods research, and I was trained at Hopkins. In my class, you'll kind of learn first the theoretical rationale for why you would use qualitative research. And then we'll go through practically like different approaches to qualitative data collection. So this includes participant observation, how to do interviews effectively, focus groups, and we'll also talk about how to analyze your qualitative data. Again, assessments for this course are written assignments and then also participation in the discussion board and live talks. And finally, we'll close out the whole program and the second course with a really wonderful course called Implementation, Making Change Happen. And this is co-taught by Dr. Connie Ho and Dr. Nazreen Jasani. And both Connie and Nazreen have been trained in implementation science and policy evaluation studies and have a lot of practical experience to draw on. So in this class, they'll kind of introduce you to the concepts of implementation science, different implementation frameworks that can help you analyze facilitators and barriers to implementing tobacco control policy or initiative. And the course will also actually cover concepts related to sort of scaling up interventions and thinking about sustainability over time. And just a final note, this is, assessments include a written assignment, participation, and then you'll also have a final presentation in this class, which is a great way to close out the whole year.
That's amazing, Lauren. And it speaks to the arc of the certificate. We kind of start with, building up leadership and understanding the history. And then we go through different sort of content areas and skill areas, and sort of end in fourth term with understanding what and how to implement policies that can have a real impact. Carla, we roughly say if you have a 3-credit class, for example, that means about 3 hours of lectures a week. And the lectures might be recorded lectures that you listen to online, or they might include what we call live talks. And so those are sort of synchronous events where students log on to Zoom and participate with the instructor and their peers. Some classes, this synchronous time is required, and other classes, the synchronous time is recorded and you can listen to it within a set timeline. For every credit, we say about 2 to 3 hours of work additionally outside of class. So if you have a 3-credit class, you will have the 3 hours expected each week to participate or listen to lecture material, but then you might have 6 to 9 hours of assignment sort of equivalencies or reading or something similar to that. So Carla, what do we say sort of weekly the expectation is for timing?
I think it comes out to about 15 to 18 hours each week.
Yeah, so to participate in the certificate, it's really clear that people understand going into this that the time commitment is between 15 and 18 hours a week. Like Lauren and I, when we were describing some of the terms are a little bit heavier than others, but this is part-time, but it's a significant time commitment to be involved here. The online learning, Hopkins has been doing online learning for decades. We're really lucky that we have an entire team at Hopkins that helps support what and how we do teaching in an online format. Our Center for Teaching and Learning helps us to produce high quality lectures for students to listen to. Our lectures tend to have transcripts. Sometimes students, especially in our certificate, because many students or most students do this course in their second, third, or fourth language. The transcripts are very, very helpful for when people are watching and listening to the lectures to follow along. Also to help you study if there are quizzes, for example, where some of the lecture material might be the premise of what's being tested. So these all help with students getting through the program. The platform does require decent internet to participate, and that is a consideration. The lectures, by and large, they're all available and recorded, and so because another common question that students have is the time zone reality, and we really strive to have a cohort in our certificate that is very diverse in terms of geography. People coming into the certificate from all different experiences really enrich the program. I think all of us that get to instruct in this certificate program, we learn so much from the students enrolled in the certificate as well. So we want that. We also recognize that makes it very challenging in when and how we schedule things, and instructors all do their best to try and navigate that. And if you do have technical difficulties with any of the online platforms, those are staffed 24 hours a day. in terms of providing support. Carla, can you walk us through the admission requirements?
Yes. So before I walk through the admission requirements, I wanted to just also briefly give you a background of what the application process looks like. So the application process consists of two parts. So the first part would be submitting all of the admission requirements listed here in the PowerPoint through our Sophos Express application system. So all of the applications will be submitted through this platform, Sophos Express. And your bachelor's degree that is required as a part of the admissions does not need to be an official document yet. This would be an unofficial transcript from your bachelor's degree or any other college level institutions that you've attended, along with a current resume or CV as well. Next, you will also be required to submit 3 letters of recommendation. In particular, we do ask that in each of these letters of recommendation, the person recommending talks about your impact or role in the tobacco control field. And then oh, sorry, Ryan. I think can you just go back again? Yeah, thank you.
Sorry.
And that's okay. And then after all of these documents are submitted through Sophos Express, our review committee then reviews them. And then the next step would be, after our review committee reviews, we may ask to set up an interview so that we can, if you are an international student, just check your proficiency in English, because the program is all in English. Okay, next slide. Thanks, Ryan.
Okay, thanks.
Okay, and then regarding financial aid and tuition, so our IGTC scholarship is the scholarship that our review committee will see if you're eligible for. You have to be from a low and middle income country to be eligible to apply for this scholarship. This will cover all of your tuition. It will not cover the Sophos Express application fee. You will still be required to pay that in order to apply, but it would cover the full tuition, and then also any credentialing that may be needed if you have transcripts from any international universities as well. And then also just wanted to clarify too that the admissions application that you submit through the Sophos Express platform is the only application that you will have to submit. You won't need to submit anything additional to be able to also apply for the scholarship application. And then the deadline for the IGTC scholarship application is coming up January 15, 2022. And it is, if you do have any questions about like tuition or financial aid, the scholarship information that I just briefly touched on here, or even the application process, I have coming up in one of our last slides a link to where you can also access all this information. And then also, thank you, Ryan. And then also my email contact, or our program director, Dr. Kennedy's email contact as well, if you have any additional questions that may come up after this session. Ryan or Lauren, did you want to add anything, or we can jump into Q&As now too?
I think we can. That's great. I think it's really important to understand the application process is not as onerous as some graduate programs might be. The questions that are included in the application process are fairly brief. And so obviously with that, we encourage people to be really thoughtful about what they put down. We are looking to admit people that are going to have opportunities to influence tobacco control in the spheres where they're working. So it's really important to highlight that. And it is a full scholarship for the students that are admitted from low and middle income countries. And if you're curious to check if where you live has that designation, we tend to use the World Bank. Yeah, the World Bank has a classification. So any low or middle, even upper middle would fall into that categorization. So should I stop sharing for a moment then? If people,
yeah, that's fine.
Okay, we can put our emails in the chat maybe, Carla.
Yeah.
And we can open it up. If people have questions, you can certainly put it in the chat. Perhaps that's the easiest way. What's the timing, Carla, for when people do apply in January? When do we typically let people know?
So we usually let you know about the next, if you would progress to the next part of the application by end of February. And then we would then get you, I would hope you facilitate that next step with the credentialing process for any international transcripts starting in March.
Right. Right. So like Carla said, those official transcripts aren't required until the initial review. Dr. Amin?
Hi, this is Dr. Ruhul from Bangladesh. I'm just asking for that you have said that you will take an interview for the English proficiency. Is it mandatory to complete IELTS or GRE or TOEFLs for these courses?
We don't have any requirements for standardized testing scores, no. No. I mean, as a note of interest, I think Johns Hopkins Bloomberg School of Public Health has done away with all standardized tests during the pandemic and perhaps won't use them. I don't know what we'll do in the future, but it's certainly a trend we're moving away from.
Thank you.
If that's helpful. It's especially during the pandemic, the expectations for people to get to a testing center and things like that is just, there's such disparity in terms of what and how that would be accessed around the world. I think it's not in the spirit of what we're trying to do. So, that's great. So we have a question from Dr. Taifour. Is there an opportunity for doctors who have no previous experience in this course? You've worked for Médecins Sans Frontières in Bangladesh for 2 years. So for people that don't have direct experience in tobacco control, your application process, you would need to be really thoughtful in what and how you're characterizing your current role or the directions you want to move in terms of what or how you would be applying what you're going to learn in this program. So like Lauren and I, when we characterize the different courses, it's very clear everything is very focused on tobacco control. Even the qualitative and quantitative methods courses, all the examples that tend to be used are very much rooted in tobacco control examples. So the specificity is pretty deep there. So we have lots of medical doctors and other healthcare professionals take the course, though. We've had lots of hand up. Jumitil Fajar?
Yes, regarding scope of the influence, is it enough if our influence just in the like hospital or the district level or the province level?
Yep.
What is preferred?
Yeah, no, characterize where you're working and what sort of reach that your position or the organizations or institutions you're working with and what and how they service. We've had people in the course before that really work at a city level. We've had people that work at a federal level or international level. There's not, tobacco control is certainly an area of public health where we've seen a lot of innovation at local levels. Cities tend to innovate, move things forward. So it's if it feels like your scope of influence is restricted, I wouldn't worry too much. Just be clear about what and how, what you're working on and what or how you would use the skills from the certificate to advance things in your jurisdiction. So is there a chance for postgraduate students currently undergoing global health? Are you currently a student? Is that the question? Like, would we accept someone who's currently enrolled in a postgraduate degree?
Yeah, good day, sir.
Hello, hello.
Yeah, some of us here were students, like 3 of my class members already joined this Zoom.
Welcome.
So we are currently a postgraduate students at University of Ibadan in Nigeria, and then we want to ask, is there going to be opportunity for us to join the fellowship program at Johns Hopkins University, sir?
So the certificate program, every person that applies is considered individually, and we review sort of the application process in its entirety. So we would look and consider what and how the person who's applied would benefit from the certificate program and what and how those skills would help advance tobacco control in the areas that they're working. We don't have a set of criteria that says yes, no, graduate students or anything like that. Every individual's career trajectory and educational training is going to be different and unique. What and how we assess who is going to be admitted into the certificate program is really based on what and how the investment is going to be. Do we think that this will help advance tobacco control in that where that person is working? Is that clear?
Yeah, it's very clear, sir.
Okay,
So,
thank you.
So I'm sorry because I joined it quite late. The process will still continue till January 22, right, sir?
The process which?
The application will continue till January 22, 2022, right?
Yeah, January 15th, I think is the deadline, 2022. Yep.
Yeah.
Okay.
Yeah, so you have a little bit of time, you could go through it and consider it. Andre Silva?
Hello, everyone.
Hello.
I have one request and one question to you, Dr. Kennedy.
Sure.
The first request is, please don't conduct this kind of meeting during the COP of FCTC COP, because I'm a Brazilian delegate. I'm at the same time following your meeting and try to hear the decisions on FCTC at the same moment. So please don't do this, because I cannot stay in the two places at the same time.
Sure.
So
it is recorded. We did plan to record it so that other people could listen anytime. We probably, yeah, sorry, but I appreciate your work at the COP.
Yeah, because it's extremely important to follow the discussion in real time, especially with Johns Hopkins, that it's a great partner to the. I work at Anvisa. Anvisa is the regulatory agency in Brazil.
I know Anvisa.
For tobacco control.
What's your question, Andre?
Nice. My question is about it's specific to you. It's about the regulatory science topic.
Right.
How do you deal during the course with different regulatory approaches? Because, for example, when you compare Brazil to the United States, our regulatory approach is very, very different.
Yes.
So they're very diverse, and include the definitions are different. So how do you do? I'm curious about to understand. I know Johns Hopkins is the best place to deal with to understand the differences, but I'm curious about it.
Yeah. So in the 8-week course that I teach, we each week we sort of look at either different products or different regulatory domains. And we certainly use Brazil as an example, particularly in the regulatory approach around additives and flavors specifically. We have guest lectures from Health Canada, from the FDA in the US. We talk about the Framework Convention. We go through Articles 9 and 10. We look at some of the assignments that students do in my class. There's an assignment where we look at e-cigarette policy regulation, for example, using the Hopkins policy scan. We have students look at, we use a media scanning tool, so we want students to learn how to use that tool, where students understand how tobacco industry conducts, or historically or in real time, an interference around policy to regulate products. I have students find industry patents to understand design techniques and what and how the patents or the legal arguments for innovations are being protected. It's one of the, I think obviously we can't cover how every single country is approaching regulatory science, but some of the leaders like Brazil are highlighted certainly.
It's just to understand the approach to it's a curious, just not asking. Of course, you have the limitations, obvious limitations. Thank you. Dr.
Okay,
Kennedy.
thanks. Well, and I hope you're able to enjoy the cup while you're there too.
So Ryan, Christian put in a question about going over sort of the weekly schedule of the course, or of the program. So just getting a sense of what week by week it might look like. I can take a stab first.
Sure.
So I think we had mentioned that it's roughly, so this is part-time, but you are taking 2 courses per term. So anticipate to spend at least 15 hours a week on course material. And so this is both asynchronous and synchronous, meaning that you can watch the online lectures at the time that you have. So each week you'll have at least 2 online lectures to watch. You'll also have maybe 1 to 3 readings to read, and perhaps you have an assignment due that week or the next week, so you'll spend some time working on your assignment. Each of the lectures is fairly manageable, as far, at least in my course. None of them are longer than 30 minutes, but it is dense content. So you'll have, probably, be taking notes, things like that. So for every 30 minutes of lecture, it's probably an hour and a half of, actually processing it. And it depends on the course. And we try to coordinate across instructors so that your assignments are sort of not all due at the same time, and that if there are live talks, which you might be required to attend if your time zone allows it, that those aren't scheduled at the same time or back to back, so that it gives you a little bit of a break. The overall sentiment among all of your course instructors is that we're here to make this work for you and be flexible. We just request that you are very communicative about what's happening in your professional or personal life, especially in the pandemic, that might limit your ability to give that 15 hours to the course that week. So just stay in really strong communication with your instructors. That's what we really recommend. I don't know, Ryan, if you have anything more to add to that.
Yeah, I would reiterate what you're saying. The certificate is designed to support students to be successful. Our cohort is maybe, between 12 and 15 students. We're not a very big cohort, which means it's really not hard for the faculty, the instructors, and the teaching assistants helping deliver the courses to be supportive. It's in our benefit for everyone to do as well as they can. Now, saying that, I don't know that we discussed it explicitly, Carla, but to maintain the scholarship in the program, students have to maintain a minimum of a B average, which in the US is a grade, or I would say a mark of 80% or greater. And so that's, and I think in most of our courses, Lauren, we have mean and median averages into the 90s. Students tend to do very well in what we're working on. And
Yeah.
so, yeah, there's a couple questions online, and I just I just looked at them briefly, but they're sort of getting at the idea of, will these credits be applicable to other degrees? Will it help me to do further graduate studies and things like that? The way this is categorized at Johns Hopkins, you're getting a certificate in global tobacco control. So it's not a master's degree. It is, you are taking graduate level courses. So it's similar to master's in that respect, but you're not getting a master's degree. If you were to apply somewhere for additional studies after this, I'm sure you could submit these transcripts if you wanted to. It's certainly, you know, people have heard of Johns Hopkins. It might be helpful when you're if you're considering next steps like this. But we can't, you know, from where we sit at Johns Hopkins, we can't say what or how other institutions will interpret it. That's a very individual decisions that that each of those institutions would take.
So Ryan, there's actually a question from, apologies if I'm not pronouncing your name correctly, Rihanna, sorry, about this question is just about people just starting out in tobacco control.
Sure.
And whether this program is a good fit. Can I get you to nod your head if that's, yes, okay, great. Okay. So yeah, so Ryan, would you take that question?
Yeah, so we've had people enroll in the certificate. They've been admitted with, you know, fairly minimal direct experience in tobacco control. Every applicant is considered in the context of their career, where they're at, where they're going. And so, you know, as someone working in tobacco control, if they're working in, you know, an NGO or perhaps a government setting or something similar to that, it could be considered a very smart investment in terms of what and how to provide skills and content to that individual moving forward. Again, we don't have a rubric with like something like a 5 years minimum here and 2 years doing. We don't do that. Everything is sort of considered in context. So is that fair, Carla? You've been through every application process. Yeah. Okay. So yeah. So I think don't let that hold you back. If this is something that you're really interested in and you're in a position where this certificate aligns currently with what you're doing to help support that, I would encourage you to apply. I'm curious how intensive the classes will be when the program starts. Did we answer that, or?
I think we did. John, if you have any additional questions or concerns, please chat them, or you can unmute and share them now. But you know, it just depends on the week, but I would anticipate spending at least 15 hours dedicated to this program.
But some of that is watching lectures. Some of that is, you know, that isn't necessarily intense. Sometimes it's actually entertaining.
Especially Ryan's lectures.
Yeah, what's more fun than learning about ammonia additives to burley tobacco? It's a fun Friday night. There is a couple questions, or I saw in the chat with respect to, you know, will you learn how to be better at managing cessation from this certificate? I think that's important to talk about for a second. This is not like a clinical training. It's people don't go through this program and learn how to deliver better cessation interventions. The orientation of the Institute for Global Tobacco Control, and by extension, the Certificate in Global Tobacco Control, we're really interested in supporting tobacco control policies that we know have the greatest impact on public health. In the Framework Convention on Tobacco Control, there's so many different articles that we've identified what we need to be doing to address this epidemic. And the WHO has highlighted the ones that we know are the most important, the MPOWER monitoring, protection from secondhand smoke. We don't tend to do a lot on cessation, not because it's not important, but because it's really hard in the context of policy. It's hard. We don't have a lot of evidence for what and how a single policy might influence or support cessation. It's obvious, like, you know, jurisdictions, I think from a justice perspective, need to be able to help people that want to quit, but we don't train people going through this program. If we were doing that, the recruitment would require us to be looking for people that have opportunities to interface with tobacco users, and it's not the mandate here. There are other courses you can take to accomplish that, and they what and how they would be taught would be very different, I think, than the format that we undertake. Is that fair, Lauren?
Yeah, I think absolutely. That's really, I think that intersection that you're describing is really useful as like a foundation for that work. But yeah, that's not the intention of this course.
Yeah.
We did have a question from Zheng about whether there's like a culminating final exam or, you know, something beyond the courses. And I think Ryan mentioned earlier that that really the only requirement is that you maintain a B average throughout each course that you take, and there is no final culminating exam or, you know, presentation that you need to give. You just need to satisfy the requirements of each course, and maintain that B average.
That's right. And that's sort of like I guess it's similar to why this is more a certificate than a full graduate program. You know, a full graduate program typically has something like a final capstone or a thesis project that you would have to do. This is, you know, each course is a standalone course, and you take that course. Some of the courses might have a final exam in them, or a midterm or tests. We tend to have a diverse range of assessments used in an effort to address different learning styles. But it's, again, there is a lot of work to be done to get the certificate through, but we have great success in terms of the students admitted completing the certificate.
Mm-hmm.
Students that have trouble completing it, it's usually because of life circumstances, not because the academics were too challenging. How'd we do, Carla? Are there other things in the chat that we've missed?
Actually, there's one question that I was going to type out the answer, but I'll just quickly chime in. So about the academic credential evaluation process. Yes, so that is not a requirement for the first part of the application process, which is where you would submit the application through Sophos Express. You only need to upload your unofficial transcripts. So that's not needed for the initial process, or for the initial part of the application process. So we would, after you submit your application through Sophos Express, and after our review committee has reviewed your application, and they then I would reach out to you and help you go through that academic or credentialing evaluation, which is where we work with a credentialing agency, whether it's WES or ECE. So we do have specific credentialing agencies that we will help you work with in order to get that process completed, if that helps answer your question. But I think I'm just looking. Yeah, I think that's all the questions in the chat.
Yeah, I think I'll sort of close off by saying that the folks that go through this certificate program, because of the size of the cohort, I would say that the students really do, even though it's online and people are from all over the world, we are successful in creating a community of people working on something similar. We know students are in touch with each other afterwards. We are building up our network of students that have gone through the certificate program. We have a LinkedIn page. So we're growing that network as well, knowing that, you know, this is an investment, and you don't just through the certificate gain the knowledge and the content from the courses. You also gain the contacts with your peers and with the instructors and the guest lecturers that come in to help deliver the certificate. And in some ways, that's remarkably valuable as you move through your career and work in this sphere of tobacco control to really address the problems we're still facing. This is still the leading cause of preventable death and disease in the world. And we need people that are skilled and confident and capable to address that. And that's what we're trying to accomplish here. So I encourage all of you to consider this and this opportunity. Of course, with specific questions about the application process, Carla is probably your best person to reach out to. If you have other specific questions related to any of the content or considerations, you can reach out to myself as well. But with that, we're just about at time, and some of you are engaged in a conference of the parties and others. So we can send you on your way, and really appreciate you spending the time with us this morning or your afternoon or your evening.